Thank you for attending today's session. We are really looking forward to the opportunity to share with you some of the insights that we've gathered at Quest Diagnostics and also some tools that we believe may help you in your journey towards driving better health outcomes for your employees. But before I get started, I really wanted to introduce my co-presenter and the opportunity that we have to collaborate with such a brilliant mind in Dr. Stephen Goldberg. Dr. Goldberg is responsible for improving member healthcare experience and outcomes for the employees of Quest Diagnostics. In one of his many roles, he is very experienced in driving positive health outcomes for Quest Diagnostics, and we're very excited to have him speak with us today. He does also lead our medical affairs team, which in fact partners with my business that we support employers across the nation. He has vast experience in healthcare, and we're excited to have him. And little known fact, he also is a practicing physician, so he does continue to work on his physicians and patients interaction. So my name is Wendi. I am the Executive Director in charge of Enterprise and Employer Accounts at Quest Diagnostics. The only thing I'm going to say about myself is that I've got 17 years of experience working with employers across the country. And the pandemic has really changed the landscape for what we do with employers, from helping employers try and stay at work with COVID testing, and now getting employers back into care after the deferred issue that we're seeing, and we're going to talk a lot about that today. So appreciate you taking the time to listen to us. Hopefully our insights and experience really give you some insights in what you can do next with your population. So next slide, please. So before we go deeper into better understanding our topic today, I'd like to give you a quick overview of Quest Diagnostics, specifically how Quest touches the lives of over 74 million Americans each year, and even more during the last 2 years. We serve 50% of the nation's doctors and hospitals, a network of over 18,000 phlebotomists and nurses. We employ over 600 doctors and PhDs, and our labs are open 24 hours a day and 365 days a year. And if we could make more hours in the day over the last 2 years, we would have. Our teams are working very hard, and we've increased the size of Quest Diagnostics. We have 2,200 nationwide patient service centers and access points for people to access diagnostic testing. So if we go to the next slide, please. Our experience spans many employers. So when we look at the employer population health business, it's one of those businesses within Quest Diagnostics that a lot of employers know about, but not a lot of people in the patient space really know about. We serve over 4,400 clients with screening programs and Connect to Care programs that enable engagement and better health. In fact, we screen in a normal year 3.5 million employees every year. During COVID, we also offered testing to over 1 million employees each year as well. So it's been a definitely interesting time for our business. Part of what we do is we really work to alert people of critical alert calls. And that is one of the services that I'm very most proud of, is that around 23,000 people a year receive a critical alert call from us, whether that be a test that is an A1C, a diabetes test that is way out of range, and we want to get them connected into care. We also help people lose weight with diabetes prevention programs. So we're very proud of this business. I will tell you, we just hit our 20th year last year of what we call Blueprint for Wellness in 2021, so we celebrated that. So now I would really like to get into the topic at hand. So if we go to the next slide, we're going to talk about the impact of COVID-19 and deferred care on organizations across the U.S. The pandemic not only created stress and strain on the healthcare system, as we all experienced, but we also saw a significant decline in the deferred care. What that means is that 41% of U.S. adults avoided medical care during the pandemic. This really drove delayed care, and delayed care creates worse health outcomes. In fact, just recently, there was an article cited in the healthcare that the healthcare system may not be able to handle the number of late-stage cancers about to hit the system. According to a doctor at the University of Maryland, a surgeon, he stated that we are in uncharted territory. He noted there are no examples of modern times where the number of screenings changed so dramatically. Without early detection of disease, doctors are practically disabled. from successfully intervening with cancers and chronic diseases. And I'm sure Dr. Goldberg will talk a little bit later about the meaningfulness to screening for him as a physician himself and a practicing physician. So not only are physicians concerned, but your employees are concerned. Your employees are basically saying that they think that their chronic conditions worsened in the last 2 years. 1/3 of your people with chronic conditions. And then 2 out of 5 Americans are concerned that they have an undiagnosed condition. So how are we going to get our employees and those folks back into care? A little bit more about, next slide, please. A little bit more about what we saw in the diagnostic space and Quest Diagnostics, because we have such a large data sets and access to those. So we saw some very important visits decline. HbA1c, I mentioned that. That is the test for diabetes, the gold standard. It is the one for managing diabetes. It is the one for identifying diabetes. Those declined by 2/3, 66% during the pandemic. Doctors' visits declined dramatically at a rate of 70%. And cancer screening is dramatically on the decline, especially colonoscopies, at a rate of 90%. We know for a fact, and we have proved it out over the years, that Healthy People 2020, if we remember those goals when they started way back early in the 2000s, maybe in the 90s even, that we wanted to get people into preventive care screenings. And seeing this decline is astonishing. These numbers are astonishing and impactful, but during the pandemic, we've worked with hundreds of employers to help them navigate their employees into the workplace virus-free. But during that time, employers have been distracted, and rightfully so, right? It has been an unprecedented time. We've all heard that. But during that time, we've also seen a dramatic decline in employees getting routine care and making tools available such as screenings. To me, I am reminded of March 2020, when we all thought we would be leaving the office for just a few short days because this virus is going to go away, and it wasn't serious. Here we stand in my home 2 years later, and when I go into the office to pick up something, I'm reminded that the calendars in the office are stuck on March 2020 because we still haven't returned the office. We dramatically underestimated what was coming. And I believe if we ignored the deferral of care, we will deal with a massive wave of late-stage disease and thus healthcare costs. So what can we do about it? Let's go to the next slide, please. How do we help employees get back into care and address this pending issue? We use lab-based screening programs. Published data shows that 89% of employees with chronic disease first learned about it through their employer-sponsored lab-based screening program. Now more than ever, your employees need support to get back into the healthcare system and to get taken care of. Nearly 3 in 10 employees have elevated diabetes risk. Half of your employees have cholesterol issues, and a majority are obese and have elevated blood pressure. The best analogy I can think of when looking at this is think about your car. It has a diagnostic monitoring system. And what has that done for us? It's led to lesser numbers of cars stuck on the side of the road because, well, they're not broken down or they're not out of gas. And so we've been lucky to have that embedded in our cars in these modern times. The same should be done for our bodies. And during the pandemic, we failed to do that. Routine diagnostics that need to happen. So we did mention earlier on that the diagnostics need to happen, but also we mentioned that there's a cost. There's a cost that employers will bear. So if we go to the next slide, employer-sponsored health insurance are bearing much of the cost for healthcare costs across the nation. And it's out of control for both employees and employers. Employees are bearing the burden. The average premium for family coverage has increased from 20% since 2013 and 55% since 2008. It's a significant increase in burden for our employees. Employers are seeing a 6% increase in spend. Yes, that's decline. We're not expecting that to continue if we look at the numbers of deferred care. On a $100 million plan, that's a $6 million increase of spend each year that you bear as a burden. If you look at the right side of this slide, this is what Dr. Goldberg and his team have done. We spend Our cost of employer-provided family health insurance at Quest Diagnostics is $22,000 per year. Our healthcare trend since 2017 has been less than 2%. So if you could decrease that $6 million to $2 million of increase that you have to bear each year, think about all the things you could do for your employees. So with that said, we're going to go and do a poll question, and then I'm going to hand it over to Dr. Goldberg. Since the pandemic, has your view on your role in health, wellness, and well-being of your employees changed? The answers are no change, somewhat changed, and dramatically changed. Go ahead and enter into the poll what you think it is, and I'm going to hand it off to Dr. Goldberg. All right, can we see the results? All right, Dr. Goldberg, could you comment on the dramatically change of the view of health, wellness, and well-being for the employees, and I'll let you take it from here.
Sure, Wendy, thank you, and good afternoon, everyone. As Wendy said, we do not want our employees breaking down on the side of the road, and we don't want them running out of gas. And in order to prevent those two occurrences, especially in the setting of a pandemic and recovering from a pandemic, there's things we have to do as folks leading employee health care. I'd like to talk to you about what we're doing and what we've done in the hope that those insights can be valuable to you. First, I'd like to point out some of our credentials. Wendi reviewed them previously. We've had very good financial results in terms of our employee out-of-pocket, the company spend, and then overall. It's been about half of what the national trends have been. And we've done that by both thinking about unit costs and high value care, but putting, frankly, a first focus on population health. I'll tell you what we've done in just a moment, but I'll begin with a recognition we received from the C. Everett Koop National Health Awards in 2020. We were very, very proud of this recognition. It goes to an organization that is actively working, getting a focus on health and a sustainable future for the entire employee pool. We have to have comprehensive evidence-based programs. In order to qualify for consideration, we had to send in actual data of our results. In addition, you'll see on the bottom there an article we published in Population Health Management, peer-reviewed journal, where we laid out, frankly, our playbook and our results and the math of our results. So I invite you to take a look at that because we wanted to share in a very transparent way what we've done on our journey. Next slide. We have an uphill climb in the employer health environment. The environment is not, by its design, set up to drive high value care and population health. This article recently appeared in JAMA. Arnie Milstein and others were the authors, and they pointed out that the health plan environment where we access it doesn't have high alignment with our objectives. In fact, the authors argue that as inflation increases, the value of health plans increase. And in fact, to best serve us, we would want an alignment whereby inflation was mitigated, high value care was driven. According to the author, this structure and this environment invites healthcare organizations to prioritize growth of high-priced services and costly marketing strategies. And there have been articles written about the impact of low-value care, fraud, waste, and abuse. And in the fourth quarter of 2019, it was estimated to be $1 trillion a year. So we have to work very hard and proactively in order to extract value for our employees. Population health is critical, proactive work is critical, and we'll talk about how we at Quest have been able to do it. Next slide. We begin with an organizing construct, our strategy of the quadruple aim. That served us very, very well. We anchor what we do on insights from both population health and our claims data. And by population health, an anchoring piece of our data is the annual blueprint for wellness screening our employees go through. Every year, about 74 to 80% participate. That's about 37,000 for us each year. And it gives us an opportunity to do three things. We identify risk, we can engage folks to drive health, and we can route them to achieve improved health outcomes. Those insights and those actions are the cornerstone for us driving improved population health outcomes in our population. Next slide. Now, when we have gone through that annual screening and we've generated our population insights, 5 areas have come up for us prominently over the past 2 years. COVID-19, mental health, cancer, diabetes, and virtual care opportunities. And we have put our primary focus on these 5 areas over the past 2 years. How did we begin? We looked at the data, as I mentioned, and we get an annual wellness report card on our population. It brought visibility to us of the opportunity in these 5 areas, and then we implemented specific actions. Now they're in small print below, but I'll describe a couple for you. So under the cancer bucket, we drove a colorectal cancer campaign, and we were able to significantly lift the number of folks getting colorectal screening. On the diabetes area, we found we had many folks on the diabetes spectrum, from mild insulin resistance to prediabetes to diabetes to insulin requiring. And many of them were not engaged. We took a fresh look at our programs, we implemented some other ones, and we had a 140% increase in those who were engaging with the offerings. And in fact, in those that had high hemoglobin A1C of greater than 8, in one of our programs, we had recovery of about 40%. So the screening that we did identified the 5 areas which created the opportunity for us to intervene. And when we intervened, we were able to show some impact. Next slide. Just like the dashboard on your car, where you get a status of how the car is doing, annual screening gives us a view of how our population is doing. How are our risks? What health actions do we need to consider? What priorities do we need to put to drive better health outcomes? So for example, we have a few categories of areas described on the right. If I just look at diabetes, we had almost 7,000 without a previous diagnosis. Without screening, I would have had no insight to that information. We were able to leverage a significant amount of folks to seek in primary care. And as a result of seeking in primary care, they were able to help achieve improvement in that condition. We did the same with findings around chronic kidney disease. We had almost 1,000 of our 37,000 that had some degree of kidney dysfunction. And we'll do a deeper dive of our results there. And also cardiovascular disease. We had folks that needed follow-up for blood pressure and lipids. Without the data, we would have not known they had a problem. Now, with identifying risk, it creates the opportunity to engage health. And the things we do include getting people to visit physicians, self-managing their conditions, lifestyle change. And then finally, we look to see if we're moving the needle, if we actually are improving health. How are we doing with CKD diagnosis? How are we doing with our diabetes population? And how are we doing with cardiovascular disease and impact? Next slide. What we are confident of is that population health can drive positive outcomes, but you have to be oriented to thinking about going upstream. Now, for us at Quest, it's easy to achieve that alignment. We have very, very long tenure at our company. People come, the culture fits, they stay, and so we build really a collaborative health relationship that allows us to do things longitudinally and see the impact of that longitudinal activity. In our experience, when you look at about 1,000 people from our employee health program, here's outcomes that we achieve in a number of different areas. First, we invite them to go to Quest for lab services. We have a broad portfolio, manage the unit cost, and we're able to save significant amount of funds from, frankly, out-of-network and surprise laboratory bills. We're excited about the people that reestablish a relationship with the PCP. We really feel that is the anchor to longitudinal health value care. We get a number that were unaware they had diabetes, and they get it recognized and have the opportunity to root in the care. We've talked about kidney disease, and we've also talked about colorectal cancer. So again, for every 1,000, there's a material number of people that have a positive next action that achieves a population health outcome. Next slide. So let's go for some discussion on some particular examples and deep dive in them. Now, the data here about prediabetes is likely very close to your numbers. These are not Quest numbers. These numbers are a summary of the literature that was published that looked at adults in the United States and looked at every study on the topic from 1979 to 2004. So this view of diabetes is a 25-year view of diabetes. And what you'll see is that 10% will develop diabetes each year without screening and intervention. That is a significant number. Diabetes costs versus someone that doesn't have it are significant. Sadly, half of people who get diabetes develop a complication within 5 years. Screening, though, creates the opportunity for early identification and early engagement. And if we look to the right, we can see some of those potential impacts. You identify someone, you potentially reduce the incidence with detection and lifestyle intervention. You can reduce the downstream impacts of microvascular complications, most commonly around the eyes. You can help prevent cardiovascular events and also long-term cardiovascular risk. So there's lots of positive things that can come from the early identification. And one of the things I want to emphasize is that you might now not yet have a process to look across your population, but based on national data, this is your population. Next slide. Here's an example of looking at chronic kidney disease. Because of obesity, hypertension, and diabetes, there's been an incremental escalation in our adult population with kidney disease. Sadly, it's now about 1 in 10. Now, we screen for kidney disease in our population, and we found roughly in our screening of 35,000 to 45,000, about 1,000 who had moderate levels of kidney disease, stage 3A. And one of the things I want to emphasize, although this slide and a lot of the conversation around kidney disease focuses just on the kidney, it's really a vascular condition. So a lot of these individuals, before they might even need dialysis, sadly have a cardiovascular event, like a heart attack or a stroke. So the impacts of this are very huge and very broad, but the exciting opportunity is that early identification and early intervention creates the opportunity to bend that curve. For example, on our outreach, we found versus folks that weren't engaged, folks were 2 to 5 times more likely to visit a physician within 3 months, a very positive opportunity. And also, we also saw that our participants were 25% less likely to have an annual glomerular filtration rate, that's a measure of kidney function, decline versus controls. Again, very positive. So if you're able to get your population in and reduce the impact of the hypertension and the obesity and the diabetes, there's so many downstream things that you can likely favorably impact. Next slide. I mentioned, and it's highlighted in a light green there, that we identified 1,000 cases in the people that we pulled. To the right, you can see the average annual cost of CKD per patient, and it increases by stage. So if you don't have formal kidney disease, meaning protein plus a kidney dysfunction, your costs are on the lower left side. On the right side, there's a quoted number of 122,000 as the annual cost for someone with end-stage renal disease. I can tell you personally, if I may, and we have 60,000 lives, that we have some employees who sadly have dialysis and have annual costs north of $250,000 a year. So this is a conservative estimate. So again, screening creates the opportunity for identification. Identification creates the opportunity for early intervention. Early intervention can help bend that curve, delay the onset of profound kidney dysfunction. Next slide. One final example, talking about colorectal cancer. Sadly, the incidence in younger folks has increased. That's why a few years ago, National Cancer Society's USPSTF recommended earlier screening, age 45, for colorectal cancer. And what you see are estimates here that if you screen 10,000, you'll generate a certain number of positives. And at follow-up next stage, so the positive would be a colorectal screening with a hemocult sample, for example. You get a certain number that will go for colonoscopy. You'll find 263 with precancers who will get in a cycle of early screening, and then 14 with colorectal cancer. And if those 14 are fortunate enough, because of your screening, to have gotten diagnosed early, the outcome is much more likely to be favorable if you identify them early than as opposed to late. And then looking to the right, besides the outcome being better, the costs will be much less. So this is something that when we did our annual screening and saw our opportunity, we went very strong on. It was one of the 5 areas that we emphasized, and we significantly increased the number of our folks getting screened for colorectal cancer. Next slide. I'm going to go to a poll question now. What is your organization planning on doing in the post-pandemic world to help employees address chronic disease and physical health conditions? Are you offering the same programs you had in place pre-pandemic? Are you offering fewer programs that focus on physical health and others that focus on other aspects of well-being? Are you offering an increased number of programs that focus specifically on physical health, or not offering any programs that focus on physical health? Look forward to your responses. Wendy, we'll turn it to you.
All right, so let's go ahead and show results of the poll. Thank you, Dr. Goldberg. Okay, so I believe that C was offering an increase in programs that focus on physical health. And that is good to hear when we see that. We have offering about the same programs as well, kind of up there too. So appreciate that you all are really looking at various different options and things you're offering. I also, it's super interesting on the previous poll where folks said that the view on employee health has dramatically changed since the pandemic. And I frankly would agree, having been in this industry for quite some time, running programs, building products, building solutions, now more than ever is really the time for us to rethink what we're doing, but also reposition and help our employees navigate healthcare. So if we go to the next slide, I just wanted to, reminisce with everybody a little bit as we think through our journey over the last 24 months. In phase one, we, hit quite a bit of confusion as an employer, and you may not know it, but Dr. Goldberg is the head of our Staying Healthy at Work committee at Quest Diagnostics, and the amount of moving, changing, shifting around that team had to do to keep our laboratories open was significant. And kudos to that team because we had to deliver a critical service for the country. But also, I looked at that and thought to myself, that's probably what other benefits leaders are seeing and doing across the nation. So what we found in that initial COVID hit was a deep reduction in force, and really nobody knew, we didn't know exactly what we were going to get ourselves into. A cessation of on-site wellness and clinic offerings, and then a reevaluation of virtual strategy. Many people were like, how are we going to be virtual? I think we've changed virtual platforms at Quest for at least twice since the pandemic of how we meet, but also how do we get back together virtually? Phase two has really been interesting in the employer space. As I shared, I also am responsible for an enterprise business, which is more our clinical side of our business, where we're selling into physicians' offices and those kind of places, urgent cares, and those folks that are dealing with, continual clinical sides of the business. And this business, the employer business, what we saw in phase two was that we saw the kind of standard, some healthcare commencing campaigns to restore volume, but the people restoring the volume in the campaigns were coming from health systems, physician practices, and we saw volume increase there, but it wasn't employers. Employers were slow and have been slow to recover their programs back. And so, we're finding that a little bit slower, but what we have as an opportunity is that healthcare has somewhat redefined itself because there's tech-enabled chronic disease management programs more available than ever. Strategic investments have been people are more used to utilizing those tools, and not just for your acute issue where you have a strep situation and you need a Z-Pak or something like that, but for chronic condition management. And I think that the world, we as consumers have become more comfortable with that. We've also become more comfortable with in-home testing. We were able to do more in-home testing. We're all able to probably test ourselves for COVID at this point, and we saw a rapid increase of in-home testing in our business where employers made that available during the pandemic. But now we're into phase three, which is navigating the post-COVID-19 world. I found this extremely interesting. We're really bracing for the impact of deferred care and we're preparing to operate with the persisting virus. Recently, we met with the advisory board and who gave us some insights relative to what we see in healthcare costs. And the healthcare costs seem to be pretty steady at that 6% increase for employers. And I recall calling up Dr. Goldberg and others saying, is that true? Is that really true? Because I believe and I feel that there is an impending tidal wave coming because I'm looking around and seeing what's happening. That's not hard to see. And so how do we prepare for that? One, evaluate the digital health budgets. You've got to make key decisions safeguarding employees for mental health. We know that's most important, and wellness. And then how do you drive employees back into care? What's the first next best step, right? And I think that we think about it in a very simplistic form because we're Quest Diagnostics, and Dr. Goldberg shared with you his story of, if you don't know what you have going on, you can't do anything about it. So if we go to the next slide, really just want to talk through what I've seen over the years as the key problems with workplace health and well-being, and it persists, and I'd actually add 4 on there, is that employers aren't focusing on it like they used to, and we need to get back there, but it's probably a different lens, and there's new tools available, and your employee is paying a different perspective and probably has a different perspective on health after we come out of the pandemic. So what we see is that screening is often seen as the end point and not the starting point. We offer an incentive, I get my money, I walk out, and I'm also not screening for things that we just talked about, colorectal cancer, doing a really good diabetes screening that includes an HbA1c, chronic kidney disease, as Dr. Goldberg talked about, extremely important, extremely cost. I shared with folks, he said it's a vascular issue. We know during the pandemic that high blood pressure has actually increased as well, which is a huge cause of chronic kidney disease. So there are things out there that you can make it easy for your employees to step into that care pathway. And then the care pathway, at-risk employees are not being provided convenient, rapid, and simple access to care. Now, I don't want to be I think the positive thing here that I really want to talk about is that I think more than ever, we have tools at our beck and call that will allow us to get convenient, rapid, and simple access to preventive care because of the digital space, the in-home, the remote collection capabilities that exist out there that our employees are more aware of now than ever. So it's a great opportunity to rethink how you're positioning your programs to your employees. So the last slide I have here today is really how you can simplify your employees' journey back to care. And when we look at it, we're really thinking about, if I were in a room, and I wish I could be in a room presenting to you directly today, I'd ask a raise of hands, how long did it take for you to get into your doctor? And mind you, Quest Diagnostics, a huge part of our business is physician offices, right? But when we think about easing our employees back into care, it takes on average 29.3 days to see a family physician from the time you initiate that. You may have something going on and it takes you a month to get in there. And it's 7 steps. When you bring employer-sponsored health screenings in, it's about 4 steps. And you're making it simple for your employees to get access to that critical care. And also, by the way, and I've been talking to many physicians, virtual care providers, they really would like to have those results when they see you so that it is a more convenient offering for employees and it is a better experience. And I bet Dr. Goldberg would raise his hand to say, if someone brought into your office a screening result that had good information, was a diagnostic test, you would go, I know what the next steps are, and I'm going to have a better conversation with that employee. So with all of that said, one, we really appreciate your time today, and we have plenty of time for questions, and I did see a few come through, so we're going to hand it back off to the producer and have some questions. Really, Catherine's going to go ahead and cue us for some questions.
Thank you, Wendi. As a reminder, to submit a written question, please use the Q&A panel located on the bottom right side of your screen. Please type your question into the text field and hit send. Please keep the drop down as all panelists. All right, our first question is for Dr. Goldberg. When do you estimate that we will see the full impact of deferred care due to COVID? In your opinion, is this something that we will be able to put behind us quickly, or will the deferred care we are seeing have a long-term impact?
4 to 6 years. 4 to 6 years. That's what we're estimating. This is something with sadly a very big tail, and there's a number of reasons for it, but that's what we're estimating.
Great, thank you. And this question is for Wendi. Can you revisit the slide discussion highlighting the decrease of testing and or PCP visits throughout the pandemic. And if you let me know what slide I was on, I would go back to that.
It is slide 6. There we go. And specifically, I can just revisit it, that we saw a decrease in hemoglobin A1C testing during the pandemic of 66% decline. That is our own Quest Diagnostics data versus prior to pandemic numbers. And that's not just our business. That is across all of our clinical business at Quest Diagnostics. The 70% decrease in doctor's visits we noted. Also, you can see the citation there, and that is also what we saw in across our books as well. And then the 90% cancer screening. We've seen some of the doctor's visits increase over time since 2020. However, it's not to the levels, even close to the pre-pandemic levels. The cancer screenings are not recovering nearly as fast, and especially colonoscopies. So we really do need to work on ways to get folks in. For those specifically, Dr. Goldberg went over some things that we do within home testing that can actually be what I call it's a gateway into a colonoscopy. It will get people activated into that colonoscopy. So hopefully that is what the question asker wanted me to go over.
Yeah, and Wendi, what I'll add with the decrease in colonoscopies, with the guidelines that have been lowered to age 45 from 50, that adds 20 million adults to the pool of folks who need to be screened. So we've got the deferred care, we've got a larger pool, and so I'm excited about the offering of home testing as a component to that whole triage of folks into care, given both delays in care, the buildup of individuals, and the expansion of number that need screening.
Mm-hmm.
Great, thank you. Oops, sorry. All right, our next question is for Dr. Goldberg. Is any of the data categorized by age?
Thank you for the question. As I'm reflecting back over our data, we in general are reporting on our employee health program data sometimes, and other times we're reporting on national adult data. And roughly speaking, and Wendi, you can edit it, our average adult age is slightly over 40 for our employee population. And national data can vary, right? Whether it's reporting 18 or above. If you have a particular condition that you would like a little bit more deep dive on, please go ahead and email me, Stephen.E.Goldberg at questdiagnostics.com. It would be my pleasure to research that for you. Thanks.
Great, thank you. All right, our next question is for Wendi. How do you DX CKD CRC on a worksite screening?
I think that means diagnose or look at CKD in CRC in colorectal cancer. So diagnosing and not necessarily diagnosing, identifying risk of CKD is done with a test called EGFR, which is, and it's probably better for Dr. Goldberg to talk a little bit through that, but the test is a diagnostic test, and it's a venipuncture test that we do. So we do, if you're doing on-site screenings, we execute and can do events with venipuncture draws, which are diagnostic tests. When we do that, we are able to look at the cohort of data and essentially identify if that person has a at-risk EGFR value, which is a calculated creatinine, if I got that right. But that is exactly how we look at that. It's an easy add-on to any lab testing panel. The second, on colorectal cancer, we have a product called Insure One that is a tier one. It has been approved by the American Cancer Association as a tier one screening for colon cancer next to a colonoscopy. So it's a very nice tool that you basically can get an in-home test sent to your home, and you swab the toilet water, and then you can send it back into the lab. And like Dr. Goldberg says, we leverage that as a screening tool, and it will, if it comes back positive, we refer people into, they will get a critical alert call, and they will be referred into a colonoscopy.
Great, thank you. Dr. Goldberg, this one's for you. At-home testing versus lab testing, which is good for what?
Oh, that's a great question. Thanks for asking it. The in-home testing platforms are expanding every quarter. By that I mean more lab tests are able to be done. Additional diagnostics are able to be done. And we're very excited about platform enhancements we're making quarter by quarter by quarter. Certain things, I would say, that require prompt response, like a stool culture or other, are more likely best managed in a face-to-face setting. But again, if you have particular screening questions that you have, feel free to reach out to Wendi and I, and we can update you on our perspective on both at-home and on-site testing.
Great, thank you. All right, and another one for you, Dr. Goldberg. It seems that the most health-conscious people sign up for screening. How do you get individuals at high risk to sign up?
So that's a wonderful question. I'll offer a couple thoughts. First, to have a company culture of health and well-being where people believe that you have their long-term health at heart. I think a second thing is leadership modeling of behavior. So bring visibility to your senior management team, to your supervisors and managers, that they themselves are engaging in the screening. With team huddles and others, we have our leaders talk about upcoming screening events, and they're very sensitive to the border of privacy. And we figured out a way to encourage and enforce the culture, but not violate that border. Next component is incentives and rewards. We give a very, very generous incentive for people to participate in our screening. And that we think is very, very impactful. And finally, there's this whole component of thinking about it, which is in the category of psychological economics or behavioral economics, books like Nudge and Habit and Predictably Irrational and 50 Bits. Human beings are folks that have to be approached in a very specific way. And what we do is we try to create a choice architecture where people are motivated to come in and get screened and then motivated to follow up. And I think, as Wendi described, another important point is making it easy. Making it easy. That's very critical, we think, to getting folks back into care.
Dr. Goldberg, I'd add one thing to your comment on culture. I was just at a kind of an all-employee type meeting a few years ago, and they knew I was the Blueprint for Wellness lady, right? And I had employees come up to me and say, this is the best benefit that we give at Quest Diagnostics. It is so amazing, and it is a culture within Quest. And we have other employers who have the same thing, that if we took it away, they would miss out on their annual screening that they get to go and they take into their doctor, and their doctor looks at it and goes, oh my, this is a lot of value. And I always say to folks, is if you are going to screen, test, do something, make it worth their time, give them insight. That is one of the most valuable things that I get out. Every year I get something out of Blueprint for Wellness. I learned I had hemochromatosis and I was a perfectly healthy 40-year-old, you know, and those are the kind of things that you learn. So anyhow, I just wanted to share that as well. It really does become a culture. It takes consistency, though, to be a cultural thing.
Great, thank you. There are no further questions, so I'm going to throw it back to you guys for your final thoughts.
I will close this up. First, thank you for all of you that hung on. I saw everybody hanging on the line. We really appreciate the time. Again, feel free to reach out to us if you have additional questions or things that you want to talk through. We really want to inform the market of what we see and what we think is going to happen. And we know that we want to be a trusted resource to help you make key decisions. So thank you for the time today, and we appreciate it. Take care and have a great day.